You're listening to the Turn Autism Around podcast, episode number 230. Today, we're doing a rebroadcast of a very important topic and question we get all the time. What is a Stim? We are talking about self-stimulatory behavior, when it's a happy Stim, when it can be a problem behavior, how to increase language and leisure activities and social skills so that stimming that is a problem that is causing injury or is very, it interrupts a lot of learning for the student and others. When it becomes a problem, what to do about it. We also have a free download at marybarbera.com/stimming. When you do want to reduce stims, but we all stim, it's not usually a problem. And today we are talking all about stimming. So let's get to this really important topic of stimming. Hi, I'm Dr. Mary Barbera. Welcome back to another episode of the Turn Autism Around podcast. I am thrilled that you're here. And if you have been listening to my podcast since January of 2019 when I started, I would love it if you would leave me a review. 5-star rating would be awesome. So let me know on Apple Podcasts or wherever you're listening to this podcast what you think of the show. If you liked a certain show, I'd love to hear more about it. And if you have ideas for other episodes or people I can interview, parents or professionals, you can always email me at info@marybarbera.com. So today we are talking all about stimming. And first I want to say that we all stim. So if you are in a lecture and it's either really boring or really over your head, you are going to engage in some type of self-stimulatory behavior, most likely. You might start doodling with a pencil. You might scroll through your phone, through Facebook. You might play with your hair. And these behaviors are all self-stimulatory behavior. And when we are not engaged at the right level, with the right level of reinforcement, we tend to drift off and either start thinking about things, start thinking about your vacation coming up, or start physically stimming to, in layman's terms, kind of keep our neurons firing. So self-stim behavior is normal. In fact, all of our leisure activities, like throwing a basketball into a net, trying to get it into the net and practicing for 15 minutes or 1 hour. And the reinforcement is actually getting the ball in the net, but we are constantly throwing the ball, trying to get it in the net as a self-stimulatory behavior that is reinforced when the ball goes into the net, the feeling of, I did it. Same with playing a musical instrument like a violin. So you are practicing and you are trying to get the note just to sound correct. So that is a self-stim behavior as well. Watching TV, like I said, thinking about things in your mind. Those are all ways to keep our mind busy when we're not actively engaged in doing something that is meaningful and with the right level of reinforcement. So if stimming is so normal, why are we talking about reducing it? And even some adults with high functioning autism think, they don't think that we should be trying to reduce stimming at all. Children with autism tend to stim more than typically developing kids, probably because they have poor language, poor social skills, poor leisure skills, and stim behavior could occur every day, all day long, a lot of the day, most of the day. And as I said, the learning can definitely be disruptive, not only for themselves, but for others around them. So some self-stim behaviors are, like I said, dangerous. So I had a 2-year-old, um, let's call him Anthony, and Anthony was banging. He was only 2. He was just diagnosed when I got put on the case, and he was banging his head on hard and soft surfaces so much that Anthony got a lesion, a open wound on the back of his head. So I was called in as an early intervention provider because I was a behavior analyst, because obviously having an open wound on your head from head banging is in need of some emergency assessment and treatment. And so when I observed him, obviously I wasn't going to be able to take really good baseline data, but I'm trying to get a feel for when he bangs, how much he bangs, and all that sort of thing. And it turned out that it was estimated that Anthony banged his head 3 hours a day. And that's what was causing the open lesion. So for him, that was a dangerous self-stimulatory behavior that we had to address quickly. I also had another former client who was in 6th grade when I started with him, and he would script. He would have nonsense language. He would say, Miss Mary has a striped shirt on, or can I hop like a kangaroo? And it was a very, what I would call a defective man for attention. And he had all this nonsense language. And when I asked the staff to count those just to get a baseline of what was going on, it was about 500 times a day that this boy would have some kind of, just inappropriate nonsense language, which were defective mans for attention. So in either case, the head banging or the scripting was interfering with the learning of these children and interfering with their in the 6th grader's case, interfering with his placement, in the 2-year-old's place, interfering with his health and safety. As I said at the very beginning, I do have a free download with the 6 steps to reduce stimming. And you can get that at marybarbera.com/stimming. We'll also link it in the show notes. So if you want to go on marybarbera.com/podcast and look at any of the podcasts, listen to them, and get any show notes or assessments or articles that I'm referencing anytime, they're always going to be there. So let me cover quickly the 6 steps to reduce or eliminate stimming. So the first step, which if you've listened to any of my podcasts or video blogs, number 1 step is always assessment. And some people call it stimming, some people call it self-stim, self-stimulatory behavior, but it can have different forms. It can have rocking, it can have banging, it can have humming, making noises, or repetitive movements like spinning or putting things in or lining toys up. And then a higher form of stimming could be scripting from movies, scripting from previous conversations. And it can involve some things like flapping, which are some of the, one of the earliest warning signs of autism as well. So you want to, when we say assessment, we want to assess the whole child and all the problem behaviors, not just stimming. We want to assess the child's age, their language ability, their social ability, the ability to imitate, match, and answer questions, and those sorts of things. And then we want to assess major problem behaviors. In the case of Anthony, his head banging was a major problem behavior. In the case of the 6th grader, it was majorly disruptive, but it wasn't really harming anybody, just affecting the learning. So if you have major problem behaviors and the stimming or scripting is not one of those major problem behaviors, then it might not even be time to really address the stimming. You might want to address the major problem behaviors that are causing harm to themselves or others first. So once we do an overall assessment, and I do have a one-page assessment and plan in my 3-step guide, which you can get at marybarbera.com/join. And that's a one-page assessment you can do very quickly on any client or your own child, no matter what the age. And that might give you a quick assessment of what might be the most important things to plan for. Okay, so once you do an overall assessment, then we look at STIM behaviors. What does the STIM look like or sound like? How often does it occur? And so for the 2-year-old, I obviously couldn't stay there 24 hours a day for 3 days to get an accurate baseline. It wasn't necessary, and it wasn't practical, and we needed to get that rocking, banging out of the way as quickly as possible so that the lesion could heal, which it did. Within a couple of months of me starting with the boy once a week, the lesion did heal and he stopped head banging so much. And then I usually, like for the 6th grader, I recommended counting on a clicker, but this was a long, long time ago. This is more than a decade ago. So right now, I don't recommend counting STIM behavior like I got 500 times a day. We only did that for like 3 days straight, and then we were able to switch it to a partial interval data collection form, which I talk more about in my online courses. But even with the 6th grader, we had a clicker and we clicked how many problem behavior, how many nonsense language scripting he did. But we would clear the clicker every 15 or 30 minutes, I forget what it was. And we would write down on a partial interval form, you know, he was in spelling and he had 30 scriptings. And then he was at lunch, and this is the number. So we would clear the clicker so that we not only had how many times he scripted, we could identify, which is the next point on the assessment, which activities was producing a lot more scripting than others. And what I noticed for the 6th grader is he was learning to type. And when he was in typing class, he had almost 0 scripts because his mind was busy. He was getting enough reinforcement and enough at his own level demands. And so during the typing class, he was great with his scripting. So then we noticed, okay, which activities have the highest scripting? We actually ended up doubling his typing time. And all throughout, I worked with this boy from 6th grade until he was 21. And in the end, we really needed to look and find a job for him post-graduation that involved really keeping his mind busy at the right, you know, keeping him really busy so that there wasn't a lot of time for this nonsense language. So overall assessment, what does the STIM look like and sound like? How often does it occur? And what activities does it occur a lot in? And what activities does it hardly ever occur? And that is going to help you go to step number 2, which is planning. And we need to make a plan based on the assessment, and we want to increase functional language, decrease problem behaviors. Now, if the STIM behavior is dangerous, like it was with the 2-year-old Anthony that I talked about, then you would want to, if at all possible, consult with a board-certified behavior analyst who can do a functional behavior assessment and or a functional analysis. However, if you are a BCBA and you get called on to a case to do an FBA or an FA, make sure you also do a language assessment such as the VB MAP assessment, or even just use my simple tools in my 3-step guide to help you see the whole picture. Because if you just go in to reduce STIM and you don't look at the whole picture, it just may end up backfiring. So step 1 is all about assessment. And step 2 is about planning. And remember that goals and the plan should be based on the child's age, their language ability, all their problem behaviors. Self-stim cannot be treated or reduced in a vacuum. In general, especially with self-stim behavior that is not harmful, I don't treat it. I just spend 95% of my time preventing STIM by getting the language up, having a lot of pairing and manding sessions, reducing times in the day or activities that will lead to high STIM behavior, and not being reactive to it. So there is a procedure that literally until a few years ago I had never even heard of, called response, interruption, and redirection. And I don't use it. I don't believe in it because it is a reactive strategy. And whenever we're reacting to problem behaviors, it's a no-win situation. And what I found is with extensive programming, using the BB map is what the tool that I use within my online courses and community. By using the BB map, getting the milestones up, getting the problem behaviors and barriers down, we can turn the tide and really help these kids. I have one example that I had a girl, I'll call her Lucy, and she was, I think, just about 5 years of age. She was going to enter kindergarten when I did my first functional behavior assessment of her. And I observed Lucy in 3 different settings: in the home, at special needs preschool, and within typical daycare, where she was there for socialization with a therapist to support her. And in all 3 situations, now Lucy was pretty much level 2, level 3 BB map. So she was 5, but she was functioning more at a 3-year-old level of language and social abilities. She had a lot of STIM behavior. In fact, I did partial interval data collection across all 3 settings, and Lucy had 90% of the intervals where she had some kind of STIM behavior. She had, she would get a utensil from the kitchen, from the play kitchen, and she would flap it. So there's a self-stimulatory behavior. That's a movement. She would also script from movies. She might rock. So 90% of the intervals across all 3 settings was she had a yes for, she did do some kind of STIM. And by the time she got to 2nd grade, those STIMs were down to near 0 levels across school and home. And people are like, well, how did you do it? Well, 3 years of great programming is how we did it. And so it's not a quick fix. If you have a kid that is very self-stimulatory, it's going to take some time, and it's going to take great programming. And if you have an intermediate learner, being level 2 or level 3 BB map learner, who's functioning at an 18-month-old level to a 4-year-old level, if you have an intermediate learner with autism who has a lot of scripting and stimming, it takes great programming, and you're not going to be able to turn things around with a reactive strategy like this response, interruption, and redirection. It's just, in my experience, not going to work. So when we talk about preventing the self-stim behavior, whether it's dangerous or not, but in the case of the 2-year-old Anthony, who was banging his head, so part of my assessment was, okay, what activities is he banging his head? And that was just through interview. Okay, when we put him down for a nap, before he falls asleep, he's banging. And he was, at that point, 2 years old, going down for 2 naps, a morning nap and an afternoon nap. So he was banging for, say, 20 minutes, then he'd fall asleep, then he'd wake up in the pack and play or the crib, start banging again for another 15 minutes. Then the babysitter would get him. He was banging when he sat in a high chair, high chair. He was banging when he was left in the living room or the family room watching TV. He was just gently banging on a sofa. So what we did, just preventative wise, just to try to get the banging down just to some degree, is we got a low booster seat instead of the high chair. We advised 1 nap a day instead of 2 so that Anthony was tired when he was put down. And as soon as he woke up, if there was any head banging, with or without, as soon as you heard him wake up, boom, you go get him out and engage him. So what Anthony really needed was to be engaged with age appropriate early learner materials and programs, and that's what we did. Okay, so after assessment and planning, the next step on this sheet of mine that you can download at marybarbera.com/stimming is if self-stim is disruptive but not dangerous, we want to, well, even if it is dangerous, like in the case of Anthony, we did eliminate all that, but we really want to focus really on language and social abilities. We want to, as much as possible, ignore, prevent the self-stim behavior as we try to turn up the burners to pair early learner materials such as puzzles, potato heads, shoebox, and all the programs that I teach within my toddler preschooler course, as well as my early learner course. If you have an older child who is not speaking or speaking very little, you can find out more about my online courses at marybarbera.com/workshop. So we want to, step 3 is to focus really on the language skills and to try to bring those up while preventing problem behavior. Step 4 is when there is no one to engage your child or clients. Say you have a meeting or you have a phone call that you have to get on, or you want to take a shower, and you want the child, remember I said STEM is just leisure activity. So there are going to be times, minutes, hours of a day when you just can't be on your child or engaging your clients at all moments. So what you want to do in those situations is pick STEM activities that are safe and as age appropriate as possible. If if he loves to line up blocks, and blocks are safe for the child, the blocks are big enough and he's not going to choke and he likes it, it's not going to hurt anything if he stims for 15 minutes or 30 minutes with the blocks while you get something done that is important to you. Step number 5, these kind of all go together, but step number 5 is to use stimming to your advantage. So when you are teaching language, look at the STIM behaviors. For one of my clients, he liked to put straws in a bottle, which was, minutes or hours a day. So he liked to put things in. So that's part of our early learner programming, is we have a lot of putting things in. So we were able to use that to help him. If the child likes to spin, you can use an office chair, and you can try to control the spin, have the child say or sign spin, and then that way you are using it to your advantage. So look at how the child spins. If they are looking at their fingers or flapping their arms, they might enjoy things that twirl, lights with sounds. If they, so just if they like to rock, you might want to get a rocking chair and those sorts of things. And then step number 6, again, kind of molds in here, is you do want to teach a child to demand or request for STEM behavior, STEM activities, materials. So, I do believe that all kids with autism, and all of us, have sensory issues, sensory needs. And so we want to enrich the environment with self-stim behaviors and stimulation. We want to be a part of it as much as possible, and we want the child to request as much as possible, because that's really going to be the thing that boosts their language the most. So say a child likes to rock. So we might get one of those big exercise balls, and we might pair the word rock and bounce and roll the ball over the child and then say roll. And so even if the child can't speak, just doing those activities, looking for things like smiles and engagement, and it may take a while. it may take a while. So these steps might really help you in terms of seeing STEM behaviors as normal, as things we just need to enrich and get more and more functional. So the key to stopping self-stimulatory behavior is to know that you cannot. You can't stop any behavior. Every behavior that it should be reduced, could be reduced, must be replaced with an equivalent functional behavior that's reinforced. So we're not looking to stamp out stimming. We're looking at building leisure skills, building language skills, building social skills so that the child can reach his or her fullest potential. So we always want to keep the child safe as possible. We want to encourage independence and happiness. Those are my goals for every child, and whether that child has autism or not. So in summary, the 6 steps to reduce or eliminate self-stimulatory behavior that is either causing harm or is disruptive is to do an assessment, make a plan, teach language, allow self-stim activities, especially when you're busy, that are safe, embed self-stimulatory behavior with yourself, like making yourself a part of it, and encouraging the child to request is the last step. Request for self-stimulatory behaviors, request with you present. So the more we can get into our child or client's world and encourage language and social and leisure skills, the better he or she will do. So if you would like to learn more about my step-by-step system to help toddlers just showing signs with autism all the way up to young adults with moderate severe autism, feel free to attend a free online workshop at marybarbera.com/workshop, and I will see you right here next week.